if we're having humans in the loop, the idea is to improve the technology and to build our trust. We have to avoid falling in the temptation, which is we have a human that provides us a summary and that we blindly approve it because we're under pressure, which raises another challenge for healthcare managers because a lot of people say, no, ambience technology and scribes will help us save time in consultations, which means that in the back of their mind, to make this profitable, we're going down from the 15-minute consultation to 10 minutes. And so the idea that AI can actually contribute to improve the humanization and compassion in healthcare goes down the drain because you're wasting a huge opportunity to be much more humane in your connection as a healthcare worker with your patient, because now you're under the pressure to do many more consultations because you have this AI technology supporting you. And so it is our general responsibility as actors in this space to make sure that we do not fall into those temptations, or else we may fall into a situation where we're using AI in a way that is not contributing effectively to improve the quality of care in a way it could if we use AI to rethink and reimagine the health system we want and not just focus on building on top of this broken model that already exists.
So welcome to Impulse, Ricardo. It's great to have you here in beautiful Paris, and have some time together during this year's edition of HIMSS Europe. So we'll dive today into one of the most dynamic, debated, and kind of like consequential frontiers in medicine that we hear a lot about in today's in the conference, meaning artificial intelligence or AI. So there's a lot I would like to cover in the episode with you, including how your personal experiences across medicine, politics, academia have shaped your vision for responsible AI in healthcare, how you think we can balance its regulation to enable new solutions for health systems while preserving their safety and the quality level, how we go about trusting these tools, and what future developments might bring. So before we head there, and as we do in every episode of the podcast, I would invite you, Ricardo, to present yourself.
Well, thanks so much for having me. It's a pleasure, as you said, in beautiful Paris, to be surrounded by brilliant minds, so committed to promoting the power of AI and digital for the benefit of health of citizens across the globe. My name is Ricardo Baptista Leite. I am the CEO of HealthAI, the global agency for responsible AI in health, a nonprofit based out of Geneva, working as a technical partner with governments towards promoting governance and regulation of artificial intelligence to scale AI solutions across the globe. My background is as a medical doctor, trained in infectious diseases. Having served in politics many years in my home country of Portugal, I was a member of parliament for 4 terms. I was also a deputy mayor and city councillor in my hometown. And my academic career has been in the space of global health, health policy, and in the frontier with digital. And also to add, because I maintain my volunteer work in an NGO that I founded in 2017, which is the Unite Parliamentarians Network for Global Health, a network of current and former members of parliaments, congresses, and senates from 116 countries that are committed to promoting science-based policymaking for the benefit of health.
Amazing. I was wondering, as I mentioned in the introduction, so your career and your background spans in clinical medicine, politics, academia, and now global health, AI leadership. I was wondering, how these kind of like varied experiences that you have, shaped your vision and also your wish to get involved, with AI in healthcare, and how we kind of, regulate it from a policy perspective.
Well, ultimately, everything I've done in my career, from being a practicing physician to politics to today at HealthAI, it's always been driven by this vision that through our actions, we can objectively not only react when people get sick, but we can actually work towards a society in which we promote health, quality of life, and well-being as our ambition as a community. The truth is, our health systems are broken. We have reactive systems that simply react when people get sick. And the financial incentives, sadly, are also aligned more with sickness than with health. It is much more profitable to keep people sick than to treat them or to cure them or to keep them healthy altogether. And so there's a need to rethink and reshape the way we organize ourselves from an ecosystem perspective. Now, artificial intelligence represents, I believe, a unique opportunity for this transformative need of health systems. If you think about it, our health as individuals depends on many factors. The clinical factors, that is what the health system looks at, just represent 10% of what actually affects our health status. 30% of what affects our health status are genomic factors and other factors that are hard to change. 60% of what affects our health are exogenous factors, our level of education, where we live, what we eat, the decisions we make every day, the air we breathe. Most health systems don't even look at that. Yet it affects the vast majority of the quality of life and well-being of citizens. The thing is, to address that seriously, we're talking about tremendous amounts of data that no human can alone process. And so AI represents an opportunity to have this big picture approach in which we can actually think, how do we want to design a health system of the future that is focused on improving health outcomes of the community at large, making sure that people live their life with the best quality of life possible. That needs to be our obsession, is improving the quality of life and well-being. And AI then is our driver for this systemic transformation. The thing is, today what we're seeing is AI being retrofitted into the current models of management, which are broken.
Yeah.
And so making inefficiencies even more inefficient faster. And so it's exactly the opposite that we need to provoke. And that's what we're trying to do at HealthAI, in the sense that we're trying to help countries build the ecosystem and the regulatory environment that not only ensures the safety of the technology, but also the conditions for the technology to scale at the systemic level so it can reach everyone and everywhere, instead of what we're seeing now, which is a whole bunch of pilots and technology being accessible just to a few who have the resources to have access. And that's why we also work not only in high-income countries, but also in low and middle-income countries that stand to benefit tremendously from the power of technology to leapfrog into a future where their health systems could be an AI-driven model.
So can you tell us more about how you go about, providing that sort of like guidance on what to use to kind of like embrace that vision of moving, away from reactive medicine to more preventive, or, to follow some of that philosophy that you shared from a regulatory perspective?
Of course. So HealthAI has positioned itself as a bridge between international standard-setting organizations like ISO, WHO, UNESCO, OECD, then at more regional bodies like the European Commission. So these bodies are responsible for publishing guidelines, standards, regulations. We don't do any of that.
Okay.
We work with what is defined internationally. And we're a bridge between those organizations and the national regulators, the organizations that today are responsible for reviewing the technologies that have access to the health system. What we do is we help translate and adapt those international guidelines to the local reality and provide the technical assistance to scale up the capacity of the country to assess these technologies and to implement them. We've developed tools within our organization. The most prominent one is our HealthAI Navigator that provides clear guidance in a very practical way of how do you then translate international guidances into the work I have to do here on the ground and then dealing with hospitals and clinics. Because one of the issues with AI is everybody's talking about it. A lot of organizations are presenting guidelines and policy pieces, but it's all very much 30,000 feet up in the air. We need to get on the ground. We need to get our hands dirty. And that's what HealthAI proposes to do. And so we've created a concept, which is the Global Regulatory Network. And we're starting with 10 pioneer countries, which will be announced after the summer. And so those first 10 countries are going to be the first 10 countries where we will be providing this technical assistance and taking these countries down a maturity journey, if you will, in terms of improving their maturity from an AI regulatory perspective. And these pioneer countries, as we call them, will have access also to two important tools. One is the Global Early Warning System. So as countries register incidents related to the use of AI, let's imagine a risk or a harm that is detected in one part of the world, all the other regulators get a red flag in real time, allowing us to act early on, building trust in this post-market surveillance approach, but also helping companies detect problems early on, avoiding reputational risks, avoiding legal liability. On the other hand, we are developing a repository or a directory, if you will, of AI solutions. So you can think of it as a global marketplace. As the regulators approve the tools for their country, those tools will appear on this platform that will be a global public good. So you'll be able to see what technologies are out there, who developed them, and which regulators for which countries have already approved them. And we believe that this will help these technologies expand beyond the markets. So even technology developed in low and middle income countries will stand a chance to be able to expand even to the global north.
Yeah. Interesting. I think it's kind of like reassuring to me that, agencies like, HealthAI exist, because I have the impression that everybody's like talking about it. We see it, in conferences like HIMSS, for example. And myself, I get to use some of these tools, maybe not necessarily like applicable for, in terms of like healthcare specifics, and I kind of like worry sometimes that we actually don't know exactly how these things work. We might not have the access to, let's say, the expertise to understand these tools like in depth, and that this sort of like partial understanding might not be sufficient to inform like, regulatory decisions that, ultimately apply over like long periods of time and, over a broad scope of, use cases. So I think it's kind of, reassuring to me that, your agency is around. I think the follow-up question I would have was, to me, regulation and AI, they kind of like differ in nature, because on one side you have that kind of like technology that evolves very, very quickly. That is also kind of like constantly mutating, and on the other side we need to, come up with rules and guidances that, take some time to be, well thought through. And then that also need to apply over long periods of time that might not, kind of like reflect the pace of how technology evolves. How do you kind of like, in your work with Health AI, how do you go about kind of like bridging these two worlds, or accounting for these sort of like two, let's say, time references in a way?
Yeah. So there is this contrast typically in when you talk about technology, which is many times the innovators believe that regulation will hold them down and bring them back, while the regulators believe that the world will collapse if regulations are not put in place. I think that the virtue is right in between, in the sense that we need a regulatory environment that promotes innovation. And what I mean by this is, unlike other sectors of our economy, the health sector is one where technology will not scale if we do not have the right governance in place. And there are many reasons for this. One is the issue of trust. You need governments or insurance companies to trust the technology, to adopt it. You need the physicians, the healthcare workers to trust the technology, to use it. You need the patients to trust it, to use it, and to accept it to be used. And so without addressing that trust issue, and I normally give the example that we use at Health AI, which is the idea of the paracetamol. When you have a fever, when you give it to your kid, you don't think twice. With AI, you're still thinking twice about the technology, because we have not reached that point of trust that is fundamental for the technology to be used in an ubiquitous way across the system. The other issue that I think is critical is getting people not only to trust the technology, but also to reimburse the technology. Because the truth is, companies are spending billions, if not trillions, in the development of AI. But the reality is somebody has to pay for it. And today you have a lot of pilots out there, but you don't see many scaling to this systemic level. And you don't really see processes in most health systems that allow you to determine the value of the technology and to reimburse it, especially when we're talking about AI that does not fall under your medical device definition, which is a more, I would say, at least in Europe and several other high-income countries, pretty well-regulated space, very well-defined. So software as a medical device actually is pretty advanced in many contexts, not around the world, but in many contexts. So the idea is, how do we arrange a model where you can reimburse technologies that go beyond that classical definition of medical device. Without cracking that nut, it's very difficult to see these technologies scale. And so, those are two of many challenges. But what is clear from this, I believe, is that for health innovation to scale, to have impact at a systemic level, you have to solve these underlying governance issues. There was an amazing company that I got to see the technology they've developed in imaging in the field of breast cancer, one of the most advanced things I've ever seen. The company went to bust. They went bankrupt because the country where they were operating said they would take 7 years to assess the technology before reimbursement. That is not compatible to the venture capital funding that is behind many of these models, right? And so you need governance systems that keep up to the speed of the way this technology is evolving. I am a strong believer that, and we want to help countries in this direction, which is the initial assessment of technology is important, but even more relevant in the future of AI will be post-market surveillance, making sure that you detect issues as you move along. There's this false idea that, with humans, we accept any kind of failure. With machines, it has to be perfect. That is a false perception. What we need to assess, just like we do with pharmaceutical products, is risk versus benefits. And if that ratio plays in the favor of humans, then we should go with it. But having very strong post-market surveillance systems to detect if something does go wrong and to detect it before harm at scale happens. So this is an evolution of thought that takes time. And so that we're trying to hopefully accelerate with all of the tools we've developed. And so with these first 10 countries, it'll be a mix of high and middle and low income countries from Latin America, Africa, Europe, Southeast Asia, and Middle East. With these countries, we will have, I would say, a very important testing ground of these frontline countries that will be taking the lead. And all the work we're going to do today will certainly be different from what we're going to be doing 2 years from now, because it has to be a journey and we have to be flexible. The technology is moving extremely fast. So being able to adapt as the technology evolves is critical, but also we don't come in with a one-size-fits-all approach. And I think this is very important. What we do is when we start working with a country, we assess the needs of the country, but also what are the ambitions of the governmental leaders and the regulatory leaders. And so we adapt and tailor our technical assistance to that reality. So if anyone comes into this space saying everyone has to follow the exact same rules in the exact same manner, it's failure from the start, right out of the gate, because you're dealing with cultural differences, you're dealing with ideological differences at the governmental level, at the local level. You really need to have a spirit of diplomacy dealing with this issue to make sure that you are slowly aligning the world in a certain direction while respectful of each cultural reality, but at the same time building sovereign capacity. And so I think this is ultimately a way of building resilience of health systems, because it's not a Geneva-based organization coming in and doing the validation for the country. What we're doing is building the capacity so the country is autonomous. And so this is critically important in a high-income country, but you can imagine how important it can be in a low and middle-income country, even to attract investments and to make sure that the technology is being used in a responsible manner. And so we're very excited to be able to, and we believe that by the end of 2026, we'll be able to showcase many of those results as use cases.
Super. You mentioned earlier, sort of like discrepancy between, those who are very much, let's say, in favor of these tools, some who are very much on the, let's say, more cautious side. Um, when I was preparing, for the conversation, one thought I had was, you know, and you mentioned that in terms of, different government style of leadership when it comes to these types of solutions. Um, and I guess one thing that we hear a lot, let's say in Europe, where it's already, we're already kind of like heavily regulating the field versus maybe what we might see in the US or in China and other places of the world, where, regulation could kind of like, put us in a situation where we might not have access to the latest tools. The clinicians might not be equipped with the best solutions available due to regulation, let's say, constraints. How do you see, your role as you are, operating, globally, supporting a lot of different countries that have lots of different types of ways to approach these solutions? How do you see your role in maybe managing that sort of, differences in terms of access to the solutions based on the different regulations?
Well, let me just maybe just disagree in part with one thing you said, um, because in reality, if you look at what is happening on the ground, not what politicians are saying,
Yeah.
but what is happening, there's actually very strict regulations of medical devices in the US under FDA and even in China. And so sometimes there's this false perception that there's no regulations in these countries.
Yeah.
The US is the country that has assessed and validated most tools in the world through a regulatory process. They have a published list of around 1,000. Some of them are are revalidation, so we're talking about around 600 tools. But ultimately, just to say that the idea that there is a lot of regulation here or none there is not actually the reality. However, um, there are differences, and those differences evolve, and political leadership can change the priorities. And so you're right, that is a very difficult space to navigate sometimes. As I said before, you need global health diplomacy in a way and technological diplomacy to deal with it. But also, you need to make sure that your mission, in our case, our mission at Health AI, is focused on the end game. And the end game for us, what our final output always has to be, is what we are doing contributing to improving the health of citizens everywhere, every citizen everywhere? And you know to respond to that, you need to listen to the citizens, you need to listen to the patients. And that became so clear to us that we decided to create a community of practice that involves now already 25 governments, but also academia. It involves international organizations, private sector partners, but also civil society movements and patient organizations. This community gets together online every other month and to discuss the issues around the governance of artificial intelligence at a global level, to reflect how the governance and regulations are impacting their lives, how AI is impacting the work they are doing, how they believe we should be moving in a certain direction moving forward. And so this community is growing fast. It started in December, already has more than 300 institutions as part of it. Any organization that is interested can apply to join on our website at healthai.agency. And it really is to create that space, because in reality, we have to be sensitive to to those differences on the ground, and ultimately not forget who we're serving. It's very easy within health systems to think we're serving either the healthcare workers or the political needs. Ultimately, our aim has to be to serve the people, be it citizens who we want to prevent from getting sick, or the patients who we need to make sure get better. And this is something that is very core to our heart. And we hope that this community will continue to grow and give us the feedback to keep us grounded in our mission.
So you mentioned also earlier the aspect of, trust when it comes to printing these tools for, clinicians, for patients, for, basically everyone involved in the healthcare system. And what are, let's say, concrete steps from your perspective that, I would say developers and regulators, need to ensure so that this trust is, kind of like built towards the end users that these solutions will be used by. I guess there is a role of, in terms of educating or reassuring on what the real risks are, or I'd be curious to hear, from your perspective, how you go about that.
Yeah. So building trust is a long process, of course, but we are, I believe, creating mechanisms in that direction. One is our inclusive process of developing the governance ecosystem through the community of practice, which I already mentioned. But also, when you think about, for example, the post-market surveillance process, having a tool that allows you to identify early on potential risks or incidents and share that information globally, it, it shows openness and it shows our capacity to detect problems early on, which means that I'm using the technology with the conscience that there is a system behind me that will detect if something goes wrong early on before it can cause harm. That kind of monitoring system is one that I think has been critical in the pharmaceutical field or even in the medical devices field that we need to continue to build on as a global mechanism that certainly will help us build trust. But also at the domestic level, at the national level, making sure that those entities responsible for assessing the technology, be it at the regulatory side, be it at different levels of the government and of the health systems, that there is the capacity to understand the technology and to pass on the proper guidelines and training of all those involved in the ecosystem is critical, because if you will always distrust the technology you do not understand. And so if we say that the citizens, the healthcare workers, the managers, they have to trust the technology, well, then we have to proactively provide them with the right guidance and capacity strengthening in that direction. And so that's all part of the different pieces of the work that we're providing. And it's an effort that every government, everyone leading health systems across the globe has to have as a top priority. The last thing maybe, which is more subtle, but I think extremely important, is we need to learn the lessons of what did not go well with the digital health transformation. As you know, digital health is the main cause of burnout among healthcare workers in many parts of the world. Dealing with electronic health records is such a hassle many times, and the benefits are not always clear for the patient and for the healthcare worker. And so I saw that in firsthand when we went from paper to digital, and seeing how it just took us more time with no benefit at the end of the day, right? And that cannot happen again. So being able to use AI that actually addresses challenges in an innovative way helps us redesign, reimagine the health system of the future to be focused not on disease, but on health and well-being. But doing it in a way where you're not forcing people to use the technology because you developed it, but developing technology that can help contribute to that reimagined system. It's a completely different mindset. And I think if we are able to do these different things, perhaps we will build not only the trust, but also the willingness to use the technology. And that, I think, are fundamental principles to scale the technology. There are other barriers we haven't spoken about, but just to say that, especially in low and middle income countries, then you have issues that are also additional barriers that make it hard to adopt technology, be it electricity, be it in terms of access to internet. And so I'm a strong believer that technology that can be low energy consumption, that can actually use renewable energy to make it work, that is low code, on device, with no need for a constant internet connection. This is the world in which I believe AI will become a reality in our day-to-day lives, in a way that today we're using AI in Google Maps or whatnot without thinking about it as AI. We have to move in that same direction with health. Despite health being a very technologically prone area, the adoption at the patient level many times is not so fast as we see in the financial sector, for example. So those kind of changes of mindset, I think, are critical so that innovators can also design technology thinking of the person at the end of the value chain who has to benefit from it. One last thing, sorry, but I think it's important because you mentioned innovators. Our HealthAI Navigator has been designed precisely to support the different stakeholders on addressing the challenges of AI, right? And so as a navigator, it brings together all the standards and regulations, and it's been designed for regulators, but actually you can access the same information with a different lens. So if you're a policymaker and you need to write legislation, or if you're an innovator, you can also access it. So you can design from the conceptualization of an idea all throughout the machine learning ops and life cycle. You can actually include the vision of how should I build the technology so it is aligned with the standards and regulations, which will improve probability of success to access to market. And so this is also an additional step, I think, that will be fundamental to accelerate the adoption of these technologies.
In one of the talks this morning, we heard Professor Stéphanie Adassonian, who was focusing on the potential of agentic AI tools in clinical decision making, and how these solutions might take a growing, let's say, decision making and operational role to support clinicians in their work. What are your thoughts on these use case in particular, and what are some of the regulatory or let's say maybe even like ethical challenges that these pose? Because I kind of understand it. This is kind of like the evolution of, for now we talk or we hear a lot about LLMs and other, let's say, technologies that are more, let's say, common now, or ambient, AI tools that enable clinicians to, have notes directly written from consultations into the electronic medical records, where they play or kind of like an assistant, but it's kind of like an advising role, and they are not driving workflows or protocols in the background. Um, how do you see this from your perspective?
So if you look at the evolution of technology over the last few centuries, the trend is always the same. You start with people not using the technology, then some early adopters pick it up, but nobody wants to fully automate, right? And so then you go down a journey that ends up at a certain point with extreme automation, right? I love elevators because they're a good story where you see how, first of all, people were not convinced about it. They were afraid to use elevators. Elias showed this at the World Fair in 1853, showed his working elevator and put himself on top of it in the middle of the World Fair and asked his assistant to cut the cable, and the elevator used security brakes, and people were awed, and they started to trust the technology, and they started building skyscrapers in New York because they could trust the elevators.
Yeah.
But we included elevator operators for decades, people to press the button for us because we were afraid to use elevators without a human intervention. But then, actually the elevator operators went on strike in the 1960s, and then people understood they could use the elevators alone, and they lost their job forever. But that being said, I think the parallel there on how technology evolves is not very different. And so the way I see it, I think a lot of the tasks we do will be automated down the road. And that's not necessarily a bad thing. It's just the evolution of technology. We just need to make sure we're doing it in a way that is safe and effective and that contributes to improvement of health outcomes. I think it'll take some time in healthcare. It'll take longer than other sectors for obvious reasons, because we're dealing with human lives here. And so until then, I see regulators probably playing a role where they prefer to deal with what we call static AI. And any improvements to the models should be resubmitted for approval. So kind of ML on the fly. I don't see it happening immediately. It will happen eventually, particularly when we can imagine a future where AI will be supervising AI in terms of post-market surveillance. We are far from that, I would say, at this point. And then you have a sociological issue, which is, can we trust a human to make certain decisions for us? I think we'll keep the human in the loop for a long time until humanity feels comfortable with many of those tasks being completely outsourced to machines. And maybe that's not a bad thing. I mean, it allows us to perfect the machines, to identify mistakes, to make sure that that we're going in the right direction. What does concern me, though, is human nature in a way, because I remember back in the days when I was working in the emergency room, these machines came out with EKG machines to do your EKG, and they used to have these systems. It wasn't even AI, but it would provide you a report based on the pattern of the line. And of course, if you look at actually how good it was not that good in terms of sensitivity and sensibility. But the fact that a machine put out a potential interpretation, I mean, a high percentage of physicians would blindly follow the machine. They would not even look at those lines. And maybe there was no match there, right? And that's what concerns me, which is if we're having humans in the loop, the idea is to improve the technology and to build our trust. We have to avoid falling in the temptation, which is we have a human that provides us a summary and that we blindly approve it because we're under pressure, which raises another challenge for healthcare managers because a lot of people say, no, ambience technology and scribes will help us save time in consultations, which means that in the back of their mind, to make this profitable, we're going down from the 15-minute consultation to 10 minutes. And so the idea that AI can actually contribute to improve the humanization and compassion in healthcare goes down the drain because you're wasting a huge opportunity to be much more humane in your connection as a healthcare worker with your patient, because now you're under the pressure to do many more consultations because you have this AI technology supporting you. And so it is our general responsibility as actors in this space to make sure that we do not fall into those temptations, or else we may fall into a situation where we're using AI in a way that is not contributing effectively to improve the quality of care in a way it could if we use AI to rethink and reimagine the health system we want and not just focus on building on top of this broken model that already exists.
I guess in your daily work with HealthAI, you're in touch with a lot of, obviously companies who are, kind of like pushing for a lot of very innovative use cases that, leverage AI and other similar technologies. Are there any, use cases that you've come across recently and also maybe from your physician perspective that, are kind of like maybe have a lot of potential in a way and that's not, let's say, covered by, let's say, the most heard of terms that we hear in conferences these days around healthcare AI?
Well, working in the space, the magical thing is that you're hearing new things every day, and I'm surprised by innovative leaders coming in the field, thinking about angles to problems that we've had for decades in a way that is truly original. And there's almost a democratization of possibilities of innovation that AI has opened up. If you look at the AI technology that exists, you can see it already throughout the whole value chain, right? From research and development. So AI is extensively being used in the discovery of new vaccines, of new pharmaceuticals. During COVID, almost every pharmaceutical company that developed vaccines that went to market had used AI in the process of R&D. But then if you think about manufacturing, logistics, all important things that we tend to forget, AI is now being used extensively. In the healthcare setting, of course, from diagnostics to treatment or across the board to virtual assistants to the scribes. If you think about robotic surgery, it's a huge area in expansion. Beyond that, even post-care monitoring assistants that keep people on their treatments in terms of adhesion treatment, population management, AI, predictive analytics used for public health purposes, for epidemiological surveillance, for identifying potential candidates for screening or for vaccination, or even in more mundane tasks that are not clinical but extremely important, like finances, auditing, financial fraud detection, claims. AI is being used in every area that you can think of. The thing is, you're ending up with so many pilots that it's a problem. The area that I think that out of the pilots, we have to see the ones that are truly effective and help them scale and create that ecosystem for that. Out of all of the areas that I've aforementioned, I think that the area that I've seen starting to grow but is less under the radar is clearly on the prevention side. So how do you use predictive analytics at the population level to detect people who are still what you could consider healthy but at higher risk, for example, and being able to proactively reach out to them and avoid them going down a path that will inevitably lead to some form of disease, prolonging their life with quality of life and well-being. That's an amazing future. And of course, that then goes down the path of personalization. I'm a strong believer that in the future, in the clinical setting, I grew up learning that treatment should be based on guidelines. I think the future is a future with no guidelines, where everyone has the potential of being treated at a hyper-personalized way. So what works for patient A will not necessarily work for patient B, or not in the same way. This idea that one pill in the same dosage will work for every adult on the planet will be something of the past. And that is there. That's a potential that's real. It's one we have not explored sufficiently, I think. But I think it's actually part of the most exciting components of this AI revolution that we have at hand. Once again, there's so much money invested in the current model of care. The incentives are so aligned in sickness that it really will take inspirational, strong leadership with visionary capacity and strategic capacity to step in and say, we're not going to continue business as usual. We're going to use the intelligence revolution to transform our system altogether.
I appreciate the nuance, I guess, that our conversation brings, because I think, we discussed in the beginning that there is we hear a lot about, AI regulation. We hear about, those in favor, those against it. I appreciate as well, I guess, the position you come from, yourself, but also with HealthAI, where you're on the service of, health systems, governments, and manufacturers to, work out what might be best for the population or the regions where, that you support. So I'm also, conscious of your time, and I'm really appreciative of the time you take during the conference to have that conversation with me. One of the recurring questions we ask to every guest on the show is, what resources would you recommend, our listeners to check out, to know more about the work you do, but also maybe more generally, I guess, AI regulation in healthcare, be it, books, publications, websites. Are there any that you would like to recommend?
Well, every summer break, starting last year, hopefully next summer break, I'll do the same. I felt the responsibility of publishing a thread on my social media, so people can find it in my social media. Last August, a list of books that I recommend in this space. I'll be doing something similar this year. And there are many publications, so it's hard for me to pinpoint. So right now I'm listening to an interesting book called AI Snake Oil.
AI Snake Oil?
Which is an interesting book around this topic of, how do you distinguish what works and what doesn't? You start reading the book and you feel it's written by people who think regulation are necessary, but then as you go along, it becomes very clear that they believe that technology actually is good. We just have to make sure that the bad snake oil that is being sold is removed from the market. And right now, the truth is we don't have the governance mechanisms in place many times to distinguish what works and what doesn't. And so a lot of companies are selling things that actually do not work, and we don't have ways to make sure that the people who make those decisions have the tools in hand to make those conscious decisions based on reality. So that's an interesting book that I've come across. The book of the year for me last year, this is completely personal, was a book that has nothing to do with AI. It's called Outlive.
Yes,
Yeah,
it's very interesting.
I found it to be extraordinarily interesting. And if you read it from an AI perspective, which it was not the angle of the author, you can clearly understand the potential to save humanity from a disease-ridden future, but to one where we can live longer, healthier lives, where quality of life and well-being are central. And we're both here in Europe, in Paris, in the heart of Europe, and the oldest continent on the planet. Longevity has not necessarily come with quality of life. The last years of life on this continent are not lived with the well-being that could be possible. And so we don't want that future, right? And so it's in our hands to avoid it. And AI can be the driving force to get us there. But once again, you need leadership who knows where to go. Because if you don't know where to go, any path will take you there, and that's not necessarily the best way to move forward. I believe that with strong visionary leadership, we can move in the direction where healthy lifestyles and well-being can be a reality for everyone, everywhere, including in low and middle income countries. And that's what drives us at HealthAI.
Amazing. I'll put all the links in the show notes, and I cannot also recommend enough Health Lead by Fidelity. I think there's probably few, let's say, doctors with his level of influence that embrace that, kind of like proactive prevention and medicine 3.0 as he explains it. So yeah, we'll put all the links. Could you share with us, an additional anecdote maybe from your work at HealthAI that, made you realize the impact that you're having on people's lives, knowing as well that, as you mentioned, the countries will be announced in a few months, but I don't know if there's any other story you would like to share with us.
Well, it's interesting to see as we step into countries and initiate, the training processes. We just had a team who was in Argentina. Before that, we had a team that was in Tanzania and Zambia. In our community of practice, we've heard amazing use case examples coming from countries as diverse as Brazil and Singapore. And what I can tell you is that just the fact that we're bringing these different countries and regulators and governments together, along with the more broader community of practice, we're seeing very serious conversations about this is what we're doing, but we are facing challenges. And no matter if you're rich or poor from a country perspective, many of those challenges actually overlap. And that's been, for me, one of the greatest revelations, which is when you see that a country on the continent of Africa, a lower or middle income country, with its context and all of its challenges, when it comes to data, when it comes to AI adoption, when it comes to having the governance system, to assessing technology and how do I reimburse it, even if they had all the money in the world, they would be facing the same problem as other richer countries in the world that also don't know how to address that challenge. And so there's almost a sense of community where we're all part of this revolution. And another book is called Power and Progress, that looks at the history of technology over the last 1,000 years. And almost consistently, what we have seen is that technology promoters, those that develop innovations, have always promised that the technology will solve the problems of humanity, but almost always it has led more to the concentration of wealth and power. The few exceptions to that was when the technology was designed from the start to address the issues of equity and inclusivity, putting human rights in a way front and center. And equity is actually a good business model because it expands the number of markets that your technology can expand to. So equity and inclusivity can go hand in hand with profitability. And so now that we're at the beginning of the AI revolution, of the intelligence revolution in health, I think what we're seeing is the potential is there. And I think that's one of the greatest takeaways of our young community of practice, is that the potential is here for us to optimize the governance models so that the technology can scale in the right way to benefit everyone, including those that are developing the technology. And so it's a very exciting time to be around and to be part of this, and knowing, but also a huge responsibility because we know it's on our shoulders to get it right.
If you would recommend a fellow healthcare innovator as a potential guest for the podcast, who would that be and why would you recommend her or him? Maybe not necessarily, in the regulation space.
Well, we already spoke of the author of Outlive. He would be a great person to listen to. I'd love to hear his perspective on AI, given his proactive views on artificial on prevention. But I would say also, if the sky's the limit and you could reach anyone, I think it would be useful to listen to Eric Topol.
Eric Topol from Ground.
Yeah, because he truly has been a leader in this field, putting science front and center in this discussion and understanding the power of AI transformation. And so he's someone I also follow very closely, and I think is worth following, and brings the right perspective. At the end of the day, we need science to drive our decisions.
Yeah, I also follow and read, let's say, very thoroughly's Ground Truth newsletters. Also, you mentioned it in the description, and as you say, it's very much science based, but also like I guess readable by people who are not necessarily doctors or scientists. Or so yeah, very valuable resource. Ricardo, thank you so much for your time. You've been very, very generous with your time. It was a very interesting conversation. I think I'm looking forward to hearing the feedback from listeners. But yeah, very warm thank you from my side.
Thank you. Keep up the good work.
Thanks for watching the episode. I hope you enjoyed it. You can subscribe by clicking on the podcast channel at the top right and watch another episode here at the bottom.